So in the New York Times, I referenced the end of American medical ideology. What I see is a historical current that we are in the middle of right now. When I talk about American medical ideology, I'm talking about the stories that medicine has told about itself, the stories that doctors have been trained to tell about themselves. It's how they understand their relationships to their patients, how they fit into systems, what their role in society is, and how they understand their moral integrity within this world. Historically in the US, physicians have been spoon-fed from the time we're in college, through medical school, through all of our training, that we're part of a virtuous moral profession that cares for others. And that is why we join the field. That's why we pursue this. And this is a very captivating narrative of ourselves. There are lots of incentives for us to believe this. This narrative doesn't really hold up that well if you look at the history of American medicine. The American medical profession has been part of a cartel, more or less. It's been a trade union that has sought to protect its own economic interests, and very often at the cost of patient well-being. Medical bankruptcy is the leading cause of bankruptcy in the US. We are part of that. That destroys people's lives, for example. And from the 1930s onwards, doctors have been part of political organizing to prevent what was regarded as a little bit later as socialized medicine. The idea that medicine, medical care might become a matter of rights rather than something governed by revenue interests. And so the AMA was largely formed to do this, is to advocate for doctors' interests, their financial interests, and also their desire for autonomy, to not have any kind of interference from government. And eventually the AMA realized this wasn't going to hold, especially around the passage of Medicare and Medicaid in 1965. There was a kind of compromise that they made to work hand in hand with the government, but to use the government like a private insurer. So it more or less continued the kind of for-profit model of healthcare that we've always had, and Obamacare doubled down on this yet again. So in this context, the idea of medical ideology is a framework to help us think about how the narratives we have told about ourselves are now disintegrating as the structure of the American healthcare industry is really becoming too pernicious to avoid seeing. We have wanted not to see how we fit into this. And I think now doctors are increasingly confronting the reality that our stories of ourselves aren't as flattering as we might like them to be. I think we have been able to sustain as a profession being overworked, being exploited for a very long time because we believed in what we did. And I think increasingly people cannot maintain that belief. It doesn't feel valuable in the way that it once was imagined to be. It feels increasingly like I might just be serving the bottom line of the hospital as I'm turning over patients almost on an assembly line and sending them back out to communities where they don't get the follow-up care they need. They don't have access to basic social services, and their healthcare outcomes are abysmal as a consequence. US mortality rates are really, really bad compared to peer nations. And this is in large part because of our healthcare system. It's also because of the way that this healthcare system has cannibalized public health, has really taken over public health and taken away from the basic social investments that we need to make. I think we need big structural changes. I don't think moral lessons in medical school are going to cut it. I don't think cultural competency is going to cut it. And I really don't think traditional healthcare reform, like another version of Obamacare, a little bit bigger, et cetera, is really going to cut it. It's important. We need to cover everyone with healthcare insofar as we can right now and use whatever means are possible to do that, because people die without it. That matters. I don't mean to dismiss that as irrelevant, but it won't solve the fundamental issue that we have, which is this is a healthcare system, even in nonprofit centers, that is predicated on for-profit incentives. I mean, we see what executives at academic medical centers, for example, are paid. That's not an accident. They're run like businesses, and they will continue to be run like businesses until we have a fundamental shift in how we organize healthcare and health systems in the US. I think the most important part of that actually is not going to happen within healthcare. It has to happen in or through investments in community-based care systems that allow for prevention, that allow for better aftercare, that allow for trust. We don't have that right now. And US public health is abysmal as a consequence. Admittedly, too simplistic formulation of what I'm saying is something like we need to shrink healthcare in order to build health. Healthcare is generally reactive. It responds after disease has already arisen. Public health is oriented around prevention. Social welfare systems allow for prevention. You can't have public health without robust social welfare systems that are publicly funded. Charity isn't enough. We have to invest in people's rights, not in just somebody's generosity. So I think in order to really make advances for health in the US, we need to take a back seat as doctors. We have often led a lot of things politically within public health that frankly we probably shouldn't be leading. People with lived experience of being excluded from these systems, who know how you need to design the systems from the bottom up to serve the people who are most suffering right now. Those are people who need to be advancing in these systems and put in positions of leadership, along with historians, labor historians, medical historians in particular, sociologists, anthropologists, environmental scientists, people who have relevant knowledge that's really, really important for public health that has largely been marginalized. So I think there's a certain kind of epistemic humility that we need to operationalize within medicine to realize that there are limits to our knowledge, and we shouldn't necessarily be running all the things that we currently are empowered to run.